Today, standing on the White House press briefing room stage with the President of the United States, Dr. Anthony Fauci said this.
When you're dealing with an emerging infectious diseases outbreak, you are always behind where you think you are if you think that today reflects where you really are. Therefore, it will always seem that the best way to address it would to be doing something that looks like it might be an overreaction. It isn't an overreaction. It's a reaction that we feel is commensurate, which is actually going on in reality.
Joining our discussion now, Dr. Vin Gupta, a pulmonologist and global health policy expert. He is an affiliate assistant professor at the University of Washington Medical Center. Dr. Gupta, your reaction to what Dr. Fauci said there, that there is really no such thing as overreacting here.
I think he's spot on. Dr. Fauci is our leader. He's our appointed leader in public health. And what I would say, just to emphasize that, is in any pandemic, it's especially if recent history is illustrative, we are reacting. We're not great at preventing pandemics. Our pandemic preparedness efforts have had fits and starts. And so we are definitely reacting to this. We're responding as the threat evolves. And I think as evidence of that, we don't even have testing at scale. So he's spot on that.
And what other equipment, there's been a lot of concentration on testing, but if we were to ever get to the right level of testing, wouldn't that then suggest that there's a lot of other equipment, ventilators, for example, that then become the next challenge?
Yeah, spot on. Right now, we have a capability, Johns Hopkins estimated it at 160,000 ventilators for the country at maximum capacity, assuming we don't mobilize the military. 160,000. A moderate outbreak, the estimates are saying that we need 200,000 ventilators. If the Spanish flu happened again today, we need over 700,000. So we are grossly unprepared from an ICU level standpoint. I can say that as an intensivist. We need more. We need more of that sophisticated capability. I will say President Trump saying that states should be responsible for purchasing respirators. That's a heavy ask. Respirators cost between $4,000 and $40,000. I mean, $40,000 rather. That's a huge ask to expect states to really foot the bill on that. And so we have a lot of ways to go in terms of true preparedness for a respiratory pandemic like this.
But also with the respirators, where do you put them? I mean, if you suddenly need to double, triple the number of respirators in this country, where do they go?
I think, to me, storage of medical equipment should be the least of our concerns. I can say this as a former military doc. We should be able to.
Well, doctor, I don't mean storage. I mean, is there space in hospital facilities now to add that kind of equipment?
The short answer, no. We don't have enough ICU beds. So this is where we're going to have to build out. We're going to have to build out triaging beds. We're going to have to build out, there's some talk about National Guard and mobilizing the military to create temporary hospitals in college dormitories or on military bases. I think that's the direction we have to go. Governor Cuomo, I think, is ahead of the curve on this, activating National Guard, really focusing on that capability that I believe President Trump has yet to utilize to the full effect.
And how do we maintain the health and safety of our healthcare workers who are involved in this?
That's such a good question. I have to say, myself, speaking for so many people in our healthcare community, we were spooked last night when we got word that 2 ED docs were critically ill, one here not far from Seattle, one in New Jersey. And a lot of that comes down to public health education about who should and should not be purchasing personal protective wear, like bat and face masks. We need to preserve that for our frontline healthcare workers, nurses, doctors, in ERs and in ICUs, especially. My wife's a pediatrician right now working in a pediatric clinic in Kirkland. I want her to have a surgical face mask. We have to have that capability. We have to have that equipment. There's upwards of, some experts are saying we need over 1 billion N95s. We have over 10 million right now. So there's a gross lack of capabilities, both in terms of equipment and PPE.
Dr. Vin Gupta, thank you very much for joining us again tonight. We really appreciate it.
Thank you.
That is tonight's Last Word, the 11th hour with Brian.